guys, today we're going to be talking about how to use a pelvic wand. So this is my personal favorite. It is the Intimate Rose pelvic wand. It is silicone, medical grade silicone, and it is awesome, and it can really help to access those deep trigger points in your pelvic floor muscles. There is also a blue version that vibrates, which can help with further relaxation of the muscles, and also a yellow one that can be heated or cooled down for either sore muscles or muscles that really need some extra warmth and help them relax. So I'll be talking and demonstrating with a purple wand today. So the purpose of this wand is for you to be able to self-stretch your pelvic floor muscles internally. Whenever you go to see a pelvic floor therapist, your pelvic PT can help you with the internal stretching with hands-on manual treatment. But it is so helpful for you to be able to use this tool at least a couple times a week at home when you are in the treatment phase of your pelvic floor rehab. So this is great for getting those deeper points, and I will show you on a pelvic model how to do this. So you want to find a place where your back can be very elevated and supported, because if you're laying flat, it's going to be really hard to do this. You can also recline in a warm bathtub, and that can help your muscles relax even more. So you're going to start with putting a lot of lube on the pointy end of the wand. This end is typically used for a vaginal release, and this skinny end is typically used for rectal release. You can use this end vaginally as well, especially if you have a lot of vaginal canal narrowing, but typically I'll keep them separate so you don't cross-contaminate. And before and after each use, you want to wash with some gentle, mild soap. So you're going to begin in a reclined position like this, and you're going to insert the wand with the skinny end up. So think pinky up, skinny end up whenever you're inserting or removing. So if you're laying down like this, you're going to insert the wand, skinny end up, pinkies up, into the vaginal canal, and you're going to find different tender points internally that cause either tenderness, the feeling like something is bruised, maybe it causes a little bit of stinging or burning, or even actual pain is possible. Whatever kind of feeling you feel that is more than just pressure is something to take note of. And that means that's an area that we need to treat. Now, you're not going to put a ton of pressure on your muscles because this area is very sensitive, and so you don't want to dig into it really aggressively. All it takes is a very gentle pressure, firm but gentle pressure on the muscles. And while you're holding that pressure, all I need you to do is focus on nice big belly breathing. If you do have a lot of pain with insertion, what you can do is to insert the wand, you can take a big belly breath in, and as you're inhaling, that's when you want to insert the wand into the vaginal canal. So for example, let's say I'm laying down, I will take a big belly breath in, insert the wand, exhale. When you are using the wand internally, you can think about the vaginal canal as a clock. So the very top here, which is the pubic bone, that is going to be 12 o'clock. So if you're laying down, it would be the hard bone in the front of your pelvis. Now, the bottom part towards your tailbone, that is 6 o'clock. On the right side, this is going to be 9 o'clock over here, and then over here will be 3 o'clock on your left side. And then you can fill in the gaps everywhere else. The only spot that you probably will want to avoid is going to be 12 o'clock. So 12 o'clock would be all the way up here. That pointy end would be pinky down, and it would hit your urethra, which would be very uncomfortable. So I typically have everyone avoid that area. You can go all the way up to here, that's totally fine, just don't go straight up and down like that. but all you're gonna do is scan the muscles, find a spot that doesn't really feel right. Maybe it just feels cringy, for lack of a better term. And then you're gonna hold the pressure on that sore spot and breathe, belly breathing throughout that hold for about a minute. It can even take up to 2 to 5 minutes for a muscle to fully relax. So be patient and be gentle with yourself. And then each time that pain, it should go away, or that feeling of urgency to pee should go away within that 1 to 5 minute time frame. And once that feeling goes away, then you can just look for another spot and then hold the pressure there if you find another tender point. The further you advance the wand into the vaginal canal, the deeper layers you're gonna hit. So I'm gonna flip the pelvis around so you can see the inside. So here we are. This is from the top looking down. If you only insert the wand very shallowly, you're only gonna be working the first 2 layers of your pelvic floor muscles, which is sometimes a big problem for a lot of people. And if you feel some symptoms there, then go ahead and treat it. But don't be afraid to advance the wand to layer 3, which will be all the way into that curve here. Because once you get to layer 3, you can actually hit these deeper muscles here that tend to cause a lot of like issues with deep penetration. And you can, so if you're gonna wanna hit this muscle here, that is right behind your pubic bone to the side. So if you insert the wand all the way to layer 3, move the wand over so that if you're laying down, the pinky end is almost facing straight down, but it's not. It's going towards the opposite leg. So I'm hitting my left hip internally, but the pointy end is hitting my right leg. And from inside, this is what it would look like. Okay, and you can check both sides. So give that a try. You really, again, it should not cause more than like 5 out of 10 pain when you're doing this. If it is really painful, then be more gentle with yourself and take it really slow, because if you aggravate it too much, then the muscles will continue to stay tight. So be gentle with yourself and take your time. Use a warm bath to help. Do some belly breathing to help relax the muscles, and maybe even do some of your pelvic floor stretches beforehand. If you have any questions about any of that, please let me know. If you are watching this video and you are not a patient, please seek out professional advice from a pelvic floor therapist that can help you with this technique and help you learn how to properly use these tools as well. If you have any questions, feel free to email us at info@pelvicprescription.com.